Hello and welcome everyone. In this session, we are going to study immunoglobulins. I have an immune system. No vaccines needed? Really? None of us has any magic potion. Therefore, our immune system requires some help. We need to administer immunoglobulins or antisera to help immune system prevent certain diseases. Let's see what immunoglobulins are. These are blood proteins which carry certain antibodies. These may be specific or non-specific. Specific means these have high titer of antibodies against a particular disease. If we administer immunoglobulins in large dose, then there is a risk of hypersensitivity reactions. The benefit of using immunoglobulins is it does not show any serum sickness reactions. What serum sickness is? Urticaria, polyarthralgia or skin rashes. These immune complex mediated reactions are known as serum sickness reactions. Now, immunoglobulins are used because they are more effective than the corresponding antisera. Also, they have a longer half-life. The main 5 examples of immunoglobulins which we are going to see are normal human gamma globulins, tetanus immunoglobulin, anti-rabies serum, anti-snake venom and anti-D immunoglobulin. The first one, rabies. For rabies, we have 2 immunoglobulins, ERIG and HRIG. ERIG means equine rabies immunoglobulins. It is of heterologous origin. What we do here is we administer fixed rabies virus in the horse. Now, whenever the horse develops antibodies, its serum is collected, preserved, lyophilized means freeze-dried and then administered to the person. And therefore, it helps that person to prevent rabies. The second type is the human rabies immunoglobulin. The benefit of using this is it is free from all the side effects. Also, it has a longer half-life and therefore we need half the dose of ERIG. The temperature which should be maintained and which should be checked before the use is 20 to 25 degrees Celsius. Okay. Next is dose. The dose of equine rabies immunoglobulin is 40 international unit per kg body weight and of HRIG is 20 international unit per kg of body weight. The maximum of ERIG is 3000 international unit, whereas of HRIG it is 1500 international unit. Now, the benefit of HRIG is it does not require any prior sensitivity testing, and the concentrations or the preparations may vary in different countries. In India, we have 300 international unit per ml for ERIG and 150 international unit per ml for HRIG. The next is the classic example, anti-D human immunoglobulin. What these immunoglobulins do is it binds the Rh antigens and does not allow them to induce any antibody formation in the Rh negative individuals. It is helpful for the prevention of postpartum formation of antibodies in Rh negative women who have delivered or aborted a Rh positive baby. Now, these immunoglobulins should never be given to the infant who is Rh positive. The administration should be within 72 hours of delivery or abortion. It can also be given at the 28th week of pregnancy. Why are we administering these? To prevent neonatal hemolytic jaundice. This may occur due to Rh incompatibility between the mother and the baby. The dose is of 250 to 350 micrograms of intramuscular injection, and it is the preparation of lyophilization, means it is freeze-dried. Higher doses can be administered up to 1000 to 2000 microgram, but these are given only in the cases where Rh positive blood was mistakenly administered in the Rh negative individuals. The next example is of tetanus immunoglobulin. Tetanus immunoglobulin is indicated in prophylaxis in non-immunized persons. Tetanus immunoglobulin could be maintained up to 14 weeks and it is more effective. Also, it is longer acting than the equine antitoxin. Prophylactic dose is 250 to 500 international unit and the therapeutic dose is 3000 to 6000 international unit. Also, both of them are going to be administered intramuscularly. The second type we have is the tetanus antitoxin, which is inferior to the human antitoxin. The dose of tetanus antitoxin is 1500 to 3000 international unit, which could be given intramuscularly or subcutaneously. The therapeutic dose is different than that of the prophylactic one. In prophylactic dose we had 1500 and in therapeutic we have 50,000 international unit, which is given intravenously, and the rest of the antitoxin preparation is given intramuscularly. Moving on, we have anti-snake venom therapy. Okay, so anti-venom is immunoglobulin and also it is enzyme refined. What we do is we administer this venom in the animal. When there is development of antibodies, we take out or we collect that serum or plasma which is immunized with the venom and we administer this in the person. It could be of two types, monovalent or polyvalent, depending on the antigen. India has polyvalent and is available against all the commonly found snakes. The four main types you can see over here is the Indian cobra, saw scale viper, common grade and the Russell viper. Indications. When are we going to administer it? After the snake bite, there is the reaction seen. The reaction has neurotoxicity, bleeding or coagulopathy, myoglobinuria, cardiac toxicity. There's also swelling and the swelling may get extended, and also there's enlargement of the lymph node. The next is the dosage. So this ASV is provided in ampules or vials. The ampule has the normal ASV. Also, the 10 vials polyvalent ASV is given irrespective of the dose. Means the snake is going to release the same amount of venom into the child also and adult also. Therefore, the administration is same in both the child and the adult. Now, firstly, we have given 10 vials of polyvalent ASV. If the bleeding does not stop, then second dose has to be given and we have to perform clotting test. If the parameters are not normal, we have to give 2 more vials every 1 to 6 hours till the coagulation parameters get normal. So this was about the dosage. How to give ASV? First of all, we don't require any kind of test in these. We take a vial, then we have to reconstitute it, and then we are going to dilute it with the help of normal saline. It may be 100 ml or 500 ml depending on the quantity. We can also use 5% dextrose solution. First 1 vial is diluted and after 10 to 15 minutes 9 vials can be added in the same fluid in the span of 1 hour. There may be occurrence of reactions such as urticaria, itching, fever, shaking, chills. There may be vomiting in the patient may undergo diarrhea, cramps, tachycardia, hypertension. Also, there may be bronchospasm which may cause breathlessness, also angioedema. So what we can do? We can discontinue ASV. Also, we have to administer 0.01 milligram per kg of adrenaline, which should be in the ratio of 1:1000, and this is given intramuscularly. Now, if adrenaline is not available, we may also give 100 milligram of hydrocortisone and 10 milligram of H1 antihistamine. We can also give adrenaline also and hydrocortisone or antihistamine also. If there's a need to continue this adrenaline or hydrocortisone treatment, a second dose of 0.5 milligram of the same ratio, 1:1000 ratio, is given intramuscularly. If there are symptoms of evenomation, then ASV can again be started within 10 to 15 minutes. Response. How does our body respond after intake or the administration of the ASV? The BP gets normal, the bleeding stops within 15 to 30 minutes. Also, the coagulation parameters also get normalized within 6 hours span, and all the neurological signs also resolve within 30 to 48 hours. So we can observe is neurological sign take the highest time 48 hours, and coagulation parameters less than that 6 hours to get normalized, and bleeding stops earlier within 15 to 30 minutes. The next are the complications. It may lead to shock, renal failure, myocardial failure. There may be bleeding also. Moving on, the last example is the hepatitis B immunoglobulin. Now, this immunoglobulin is 10 to 18% solution of human immunoglobulin, which is a high titer of antibody to the antigen. Which antigen? Hepatitis B surface antigen. It is a better prophylactic than the normal gamma, which is normal human gamma globulin. The dose of it is 1000 to 2000 international units. Normal human gamma globulin also is a concentrated immunoglobulin which is obtained by fractionation. Fractionation means we have to separate it in a cold from whole human plasma. What are the uses of hepatitis B immunoglobulin? Uses are viral hepatitis B, viral hepatitis A, measles, mumps, poliomyelitis and chickenpox. For diphtheria antitoxin, we have dose of 20,000 international unit, and the maximum we can give is 1 lakh international units. Now it's the question time. The very first question, what's the maximum dose of diphtheria antitoxin? We have seen it recently, 1 lakh international units. Second question, administration of anti-D immunoglobulin is within 2 weeks of delivery, 3 weeks of delivery, 8 days of delivery or 6 days of delivery? Answer is fourth option, 6 days of delivery. The third question, what is the therapeutic dose of tetanus immunoglobulin? The dose is 600 to 1000 international unit. The fourth question, which of the following is true about rabies HRIG? We had seen it recently, superior than the ARS or ERIG. The very last question, each ml of polyvalent can neutralize 1 mg of cobra venom, 2 mg of cobra venom, 1.6 mg of cobra venom, or 0.6 mg of cobra venom. The answer is 1 ml of polyvalent ASV can neutralize 0.6 mg of cobra venom. Thank you all for listening.